Hello, everybody, and welcome to the August 12th edition of the Decaturish.com Twitch Show. I'm your host, editor, and publisher, Dan Wisenhunt. Today we have a very special guest. Her name is Amber Schmidtke. She is a COVID-19 expert, does a very popular newsletter, and runs a very popular Facebook page about COVID-19. Amber, how are you today?
I'm great. How are you doing?
Great. Looks like everything is just fine. Thank you for joining us. Our other guests today are Decatur's contributor George Cheedy. George, how are you? Awesome. Contributor Hans.
I'm great.
Good. Good to see you, George. Hans Utz, another Decatur's contributor. Hans, how are you?
I'm doing well. Thanks for having me on today.
Hans, I did look at your column. I sent you some notes. Kathy Harris, another Decatur's contributor. She primarily covers planning and affordable housing issues. Kathy, how are you?
I'm great. Thanks.
Thank you for joining us. So the way this works is we're going to talk to Amber for a little bit. If you have questions, go ahead and sign up for a Twitch account and jump into our comments section and ask her a question. So let's get started. Amber, tell us a little bit about what you do and how you came to be writing this newsletter that, frankly, it's required reading for many people on a daily basis, including myself and I'm sure other people on this panel.
Thank you. That means a lot. No, so I have a background. I used to work at the CDC in Atlanta. Used to spend a lot of time in Decatur, actually. But I worked there for 4.5 years and then went on to become an educator. I've been teaching undergraduates and medical students in the recent years. And so I found myself in a really interesting position when the pandemic started, in that I knew how public health professionals spoke and presented data, and then I knew that there were going to be gaps in the way that the public could understand it. And I had a background in teaching people that weren't scientists. So I kind of stepped into that role first, just with my bubble of students, family, friends that were just sort of like, what is this COVID-19 thing and what are we doing here? And then that kind of expanded first through Facebook. And then, because people expressed an interest in having a non-social network based way of getting the information, I started doing a newsletter. And so that's kind of where we are now.
And so how many people are on your newsletter now? It's quite a bit.
Let me see. There's a mailing distribution list of about 11,000 people, and the Facebook page has almost 20,000 followers.
Oh,
so.
Man, that is a lot. So just for perspective, I've been doing Decaturish for 6 years, and I just got up to 14,000 followers. And you've been doing this for how long?
4 months.
Yeah, so that's a lot in a short amount of time. One thing you said,
All you need to have happen is a global meltdown driven by a
Right.
massive pandemic, and then you can be great.
So Amber, you mentioned, and I'm glad you said this, that part of your job was teaching people who maybe didn't know a whole lot about science. And I feel like that translates really well into what you do, because one of the things that you're doing that I think no one else has really got the market on right now is making this make sense so people like me can understand it. You're communicating it in a way that reaches a broad audience. Would you say it's kind of an accurate description of what you're going for?
It's definitely my goal. I think that some updates are better than others in achieving that goal. But yes, that's ultimately what I'm always thinking about is, can I explain this in a way that my dad will understand it? And my dad he's a smart man, don't get me wrong. That's not what I'm saying, but he's not a scientist. And so could I explain this to my dad and make it meaningful for him? Because he's one of those people in the most vulnerable category. So I need it to make an impact for him.
Right.
So that's kind of my barometer of success, I guess, is what I would say.
Yeah, that's definitely a good way. In news writing, we always write for, we call it getting it to where the goats can feed on it. We're always trying to write to, reach the most people. So you actually had a pretty interesting controversy come up with regard to Facebook pulled down one of your posts for some reason. What the heck happened there?
I still don't totally know what happened there, but
Tell us what you do know.
Okay. So I started out using MailChimp for my email distribution list. I wanted to support a Georgia business as much as I could. And, a lot of this I'm doing without funding. So I was using their free account. But there was a ceiling on that. I could have either 2,000 people on my distribution list, or I could reach them 10,000 times, but I couldn't do both. And so I was starting to exceed their capacity. I broke MailChimp. And so I had to go to Substack, which is where the newsletter's housed now, and it has none of those limits. But for whatever reason, I'm publishing and doing just fine for about a week. And then all of a sudden, something has been flagged about Substack through Facebook that they're no longer allowing my posts to be visible. Nothing that links back to the page. And it was interesting because I reached out to Substack first and foremost, sort of like, if it's happening to me, it's probably happening to your other authors. But they were like, yeah, it's not happening to any of our other people. So it's kind of strange that Substack, that they're telling you, through Facebook support, they're saying the problem is with Substack, and Substack saying, we don't know what they're talking about. But luckily, when you have a fan base of 20,000 people, some of them know people within Facebook, and a lot of media follow me. So I've had a lot of people reach out on my behalf through different avenues, and ultimately a social media watchdog group called Truth or Fiction ended up getting traction with Facebook, and they were able to get that overturned. Basically, they said that it was a coding error erroneously flagged, which was, again, kind of bizarre because it was around the same time that Facebook was trying to broadcast like cracking down on COVID information to make sure that it was factual information going out. And I was like, this is definitely not spam. Like, this is
my
legit
first
info.
reaction when I heard about that was I assumed it was people that who disagreed with you who were flagging your content to try to manipulate the algorithm. But you don't think that's what happened, or do you know?
That could be what it is. And so that was what I assumed as well. I figured it was trolls or whatever that didn't like the truth. And so they had flagged it. But according to Facebook, that wasn't the issue. So I never did get a clear answer. That was the weirdest thing of all.
According to Facebook, though, is an awfully rough road to go down. Like, let's just assume that they haven't told you what the actual truth is.
Exactly.
So, but your content's been restored is the end result. So
so it was down for like 3 or 4 days, and then it was fixed. So.
Gotcha. Well, that's good.
Is it just one post? Sorry to interrupt.
No,
or
please.
is it your entire page that they were?
No, it was anything with my URL was being flagged, and people couldn't even send it through Messenger, put it in comment sections. It wasn't just me; like nobody could paste the link anywhere on a Facebook platform. So including
and no
Instagram.
other Substack. At least Substack says no other Substack author was experiencing that.
That's what they said. So
I have to assume that people were brigading your page, frankly, in order to mass report it, in order to get it driven off of Facebook. Do you have any sense of who that might have been?
I don't, I was worried about that too. And of course, I'm like Google searching my own name, trying to figure out if there's some sort of concerted effort against me. And I never did find anything. I had a few friends say, a few followers that were saying, so-and-so who's a friend of mine really doesn't like your work. So I wouldn't be surprised if it was him. But again, that's all anecdotal stuff. I didn't have anything that like linked anybody to anything.
So let's talk about who exactly is it that takes issue with what it is you're doing, because all you're doing is relaying facts, right? I mean, you're not. I mean, you're interpreting it a little bit and offering your take on it a little bit, but it seems to me that everything that you write and have done has been driven by the data, is it not?
Absolutely. I mean, I've always been, and especially in this pandemic, it's become so politicized that I've always been like, just go to the data, right? Because the data don't have an agenda. And so I really try to let the data lead everything that I write. And yes, I do provide some context for what certain things mean, or, analysis of what it could portend for the state. And unfortunately, sometimes that doesn't necessarily reflect well on our state's efforts. And so I think political loyalties being what they are, it makes certain people uncomfortable. And that's all I can come up with.
So let's talk about the state. Give us the lay of the land. How are we doing? And I can tell you, anecdotally, it must not be too good because my kid can't start kindergarten on Monday. So I know that much. But give us the big picture. Where does everything stand right now with regard to this pandemic in Georgia?
So I think that it is not great. Is the simplest way to put it at first. We didn't really follow any of the guidance in terms of the reopening plan that was proposed by either the White House or the World Health Organization, CDC, any of those folks. We kind of went rogue and went our own way. And that's an experiment, I suppose, that's worth doing, but it hasn't really panned out for us. We've got really we had an episode there of exponential growth. I suspect it may still be happening because we have some significant testing backlogs right now. But so we've got that going on. We've got hospitals that are running out of capacity. So if you think about our pandemic response being like a table, and there's different legs that hold up that table and we need it to be level. Testing is one of those legs, contact tracing is another, our hospital capacity is, I guess it's a three-legged table, right? So, but we need those three things to be working well in order for us to cope, monitor, and track this thing. And our testing is, we're way outmatched right now. We've got more transmission than we can test for. We've got people that are waiting hours to get their specimen collected, and then they're waiting weeks to get the result. And so if you're a contact tracer that then has to call them to ask, who did you come into contact with? And oh, by the way, that was 3 weeks ago. Most people don't remember what they had for lunch yesterday. So they're not going to remember who they ran into 6 weeks ago. And heaven forbid they went to like a big gathering. It's going to be a very hard task to track down. So if both of those things are not doing super great, and an NPR investigation last week showed that we only have like just under 12% of the needed workforce for contact tracers in Georgia, we're kind of behind the eight ball. And then of course our hospitals are feeling the strain, especially in certain parts of Georgia. So between all of those metrics, it's a shaky table is, I guess, the way to sum up the analogy. So I would love to say that, we're on track for greatness now that we've opened schools, but I'd worry that we already had a lot of transmission going on in our state and in our communities. And opening the schools just opens up another opportunity to add transmission to a situation that's already out of control, hard to track, hard to monitor.
Yeah, so kind of what's happening for people who might be not in Georgia. You got all the metro districts are basically, Fulton County districts and DeKalb County are all going to be virtual only. So we're not going to have any in-person school. And then you've got districts that are a little bit further out who are trying to have in-person school, and it ain't going so well. Can you give us kind of a recap of what's been happening in some of our local school districts, Amber?
Sure. So at least, I'm one of those parents too. I love seeing the first day of school photos. I think they're amazing. It's so great to see everybody's friends, kids growing up. But we've seen different schools kind of adhering to different amounts of the public health guidance in terms of mask wear, social distancing, cleaning, that kind of stuff. And so, we've had some schools that let's put it this way. We have some schools that seem to be doing great in the photos, and we had certain schools that weren't, and then made national headlines for crowded hallways and group pictures out front. And then it turns out that some of those schools now have had cases identified at the school. And while some of those cases, probably they were in their incubation period and infected before they came to school, that's one thing. But the scary thing is that they were infectious while they were at school, in those crowded hallways, in those buses, in those classrooms. And so do we have like the beginning of new outbreaks taking place in these classes? And so that's why we've seen some of the school districts in the outer lying suburbs have to close for deeper cleaning and for isolation and contact tracing.
So let's start with some panel questions. Kathy, you've done some work on this for us as well. What questions do you have for Amber?
Mine goes back to a little bit about the testing and the amount of testing that we're doing. So if I understand kind of what I've been reading from your newsletter is that we're not doing enough testing to identify cases, that we're probably got cases out there that we're completely missing. So do you have an idea of like how, I think we're 9th in the nation and we're doing about 20,000 tests a day. Do you have an idea of like where we should be in order to accurately detect like the true transmission?
Great question. We are in like the top quarter of the nation, which ordinarily would be a great thing, right? But it's still not enough because we have such a high amount of transmission in our state. And so we're averaging, last week we averaged just about 30,000 test results a day, which was a big improvement. Last week was a record-setting week. But our average percent positivity rate is high still. It's about 10%, and we need it to be at or below 5%, according to the World Health Organization. And that seems kind of counterintuitive. Like, why would you want to do all of this testing for 95% of them to be negative? It seems like a counterproductive use of time, money, and effort. But the reason why is because it's supposed to go with contact tracing, in that when a case is identified and the contact tracer gets in touch with them, they reach out to all of those known contacts and offer them a test. And we want 95% of those to be negative, because it means that we caught everybody that might have been asymptomatic. Here in Georgia, we're doing things kind of, like I said, rogue. We're not following any sort of strategy. It's anybody who wants a test can get a test, which feels very democratic, right? We want, that's a very uniquely American thing. But we also, because we have such widespread transmission, we're still not probably capturing the amount of testing that we need to be. So it's hard to quantify where we probably need to be, but we've seen that this can work. I posted something last week about how in New York, they were, of course, we all remember the scenes that were awful back then. And it seemed like an out of control situation that was never going to get under control. But they have locked down, they have expanded testing. And so last week, I think they averaged like 3% positive rate. So it can be done. And so I would just say, I don't think that it's worth it to throw the baby out with the bathwater, so to speak. Like, we need to go ahead and try to do this right, even if we didn't get it right the first try.
So
is it safe to say, sorry,
let me
sorry,
check
Dan.
in real quick. If you're just joining us, this is the Decaturish.com Twitch Show. Our guest is Amber Schmidtke. If you have a question, create a Twitch account, get in our chat and ask it. Hans, you had a question for Amber.
Yeah, I was gonna. Let me try to pull it back to the front of mind, but the way that New York got in front of its testing problems, the challenge that you have with testing, right, is that it's a linear thing. You add a tester and you only get a certain number of additional folks that you can test with that tester. Whereas transmission is happening exponentially, right? So one person that has it is spreading it to many, many, many people, and many, many people are then spreading it to many, many, many people. I mean, basically, we can't sufficiently add capacity to testing in Georgia unless we are also taking steps to slow transmission, right? Like New York did the hard lockdown, masks were mandated, things were shut down. And so by the combination of those two, increasing testing capacity, but absolutely also taking the difficult but necessary steps to slow transmission, is what allowed them to get in front of it. And we're still behind it. Like, I mean, that's the only way to say it. It's still basically in free transmission out in the, is that a fair statement?
No, absolutely. I think those two things absolutely go hand in hand to help us, like you said, to get in front of it. So if we have uncontrolled transmission, we could add 1 million tests a day, and we may still not have enough. So if we really want to get serious about this, if we want to get serious about reopening schools, reopening businesses, then we've got to collectively as a community do more to limit transmission. And in the absence of some sort of a statewide mandate, we're asking 10.6 million Georgians to do the right thing. And even the governor has tried to do that through some of his, sort of goodwill campaigns, and it hasn't totally worked. So I think that, we do need a greater sense of coordination to get us to the other side.
George, what about you? You're muted. Oh. You're muted.
Sorry about that.
Okay.
Like, it's, for whatever reason, this was being weird with me. The thing I look at when I'm looking at all of this is, as a practical matter, what data can be used to pull people who are nuts, frankly, out of being nuts. Like, even now, today, like, I get into conversations with people who are like, well, yeah, but the fatality rate's only 99 point whatever, or the rate's 99.5%. We shouldn't, even though it's not. That somehow that this isn't significant enough. And like this, I point people back to data like the excess death rate to say, look, no matter what you think is happening, like this number of people are dying and it's higher than that. I'm wondering what data you present that you believe is convincing for folks who really just don't want to hear any of this right now.
Right. I think that's really hard because we've got a certain segment of the population that doesn't like data regardless of what it shows, or they have an apprehension about perceived elitism or something that they don't want to accept it. And so as much as I try to be there for the lay people and non-scientists, even there's going to be people that still don't like it. I still think that the excess death rate that you cited is probably my strongest batch of data to show people in terms of the impact, because people will be like, we don't know how many cases there are. We don't know how many deaths there are. And yes, that we have imperfect data. But what excess deaths show, for anybody who's listening who doesn't know what that is, it's looking at all the deaths that have happened regardless of the cause. So it doesn't matter what it says on the death certificate, pardon me, whether it was COVID or a car accident or et cetera. We're just looking at all the deaths that have happened this week and for the last year or two, compared to the average for the previous 5 years. And so anything that's above that average or predicted threshold is considered excess. And we are well above that ever since April, both nationally and for the state of Georgia. And you can look this up for yourself. If you just Google CDC and excess deaths, there's a really neat dashboard where you can look at it by age group, by region. There's all sorts of different things. And we had blips before where we've gone above the threshold, but you know what they all have in common? They're all infectious diseases. So the previous one in 2018, January-ish, was a severe season of influenza. And so again, it just goes to show the impact that infectious disease has on the human population. But yeah, I do think that the excess deaths are some of the most striking pieces of information to show people, because it's not like we've had a major catastrophe this year, thank goodness, that might account for that. The only thing that has changed this year compared to previous years is COVID.
So what? Go ahead, Don.
Well, I was gonna say. I mean, I appreciated George's question with sort of the forced naivete that was behind it, right? But the fact of the matter is, there is going to be a segment of the population that is unreachable with logic and fact and compelling data. Like, that doesn't resonate, right? It's not the perspective in this particular group of people isn't related to fact. And if that abdication of fact exists, and it's not new in American history. I mean, we used to have a political party called the Know Nothing Party. I mean, like, this is historically a strain of insanity in America that has been with us all along. What you would desperately hope is that the leadership that's in place would actually take the facts, and despite the group of people that are insane about it, would actually act in accordance to what the facts dictate. And I'm not going to ask your opinion on that, Amber, unless you want to offer it, but I will certainly offer mine. In the state of Georgia, without question, our leadership has absolutely abdicated what the facts have said. And we are in a position where our direction and what we're being asked to do is woefully insufficient for the challenges associated with this virus rampaging through our communities right now. It's really tragic.
Yeah, I'm not going to step on that particular landmine, but I will say that there are a lot of there's a lot of bipartisan effort to recognize facts, even within the state of Georgia. I've been really impressed. Just this week, the city of Dublin, Georgia, which is in Lawrence County, not far from where I am, that's a staunchly Republican area. And because they are having such widespread issues with the disease, their hospital region is out of ICU beds. Even they have instituted a mask mandate, and they're begging the governor to do so also. And so I think that's really telling, that really this shouldn't be a political issue. It should be a data-driven issue. And I really hope that at some point that can be what happens. But I have to hope that there are enough of us that can appreciate data for what it is to make those decisions based on data. And that's
Have you seen an improvement in Georgia public health data reporting? Like they're not changing the baseline on the color coding that they provide counties based on spread. Like, have you seen an improvement in the way that that gets reported, or is that still troubling to you?
So something I should say right from transparency purposes is that I do some consulting for the Department of Public Health as a volunteer. So I have helped them with some of their visualizations because there was an admitted problem in the early days, and they, really kind of wanted to improve the way that their data was presented to the public. So I have been able to help with some things. There are certain things that I advise and nothing happens with, and that's okay. So what I will say is I have really appreciated some of the changes that have happened lately that allow us to see recent data, because I think that, we can track data from a historical perspective from the beginning of the pandemic, but ultimately the people who were sick in April might not be participating in this pandemic anymore. And so if we're trying to see how disease intensifies over time, we really need to be looking at more recent information, because otherwise Southwest Georgia is always going to look like a hotspot, right? So I think that has helped. And I hear that there are more changes coming. And so I'm curious to know what all those will be. So I guess I don't even know if I've answered your question, Hans, but I think.
Well, it is an interesting because that, I mean, you bring up, this is getting a little bit into the nuance of the data, but yes, if you're looking at absolute total counts of cases by county, then that's actually not particularly informative in terms of the spread. What you care about is like the active current cases by whatever the particular per 100,000 or per population per county, whatever that may be. Yeah, and so that's I was unaware that there was. Well, I mean, that's actually not true. I've seen things where they've shown total case counts by county from the beginning, and you're right. That's not actually tracking what is happening today. Those counties may be actually doing much better today, and what we really need to be seeing is what's kind of what has been happening within the window of the typical infection length in the last couple of weeks, right?
Yeah, I will say when I go to the data, in case it helps anybody to know how I view the data, the first thing I'm looking at is the cases in the last 2 weeks. And I like that is adjusted by population, because 10 cases in Fulton County is not the same thing as 10 cases in Glasscock County, because they've got a much smaller population. So that 10 cases may be devastating to a smaller county than it is to Fulton, for example. So I think that's really important. I also look at what's going on with the case and death curves. And then I check every day in the tab area where it says deaths in Georgia, and I sort by age to see. And that's how I was able to be one of the first to report that the 7-year-old had passed, unfortunately, last week. And it's not like a race to be the first one, but just as a mom and as a parent, you're just sort of like, God, where are we? And, where are we headed? And yikes, this is awful. So.
Yeah, I was almost commented on that because very early on in the process, they had reported erroneously that a younger child, maybe like a 9-year-old child, had died
15.
in DeKalb County, and then they abruptly about faced, and it made me a lot more careful about reporting just the stuff that comes off the state data. What I was curious to get your thoughts on. Do you think that there has been an attempt by state officials to manipulate the data that we're seeing?
Ooh, that's a good question. So I will say that the page itself is very political. Public health is very political, because at the head of every public health agency is a politician or a political appointee. So I will say from my experience, there have been things that we have wanted to show on the Department of Health website that we weren't allowed to. There have been things that we had, or that they had to include, that weren't necessarily guided by the epidemiologists. So I think, and I can't really comment on what those things are, but I just can tell you from my experience that has been what I've observed.
So we have a question from a reader. The reader says, state numbers of cases are widely available. However, if someone living in Gwinnett County wanted to know the case numbers of their local municipality, would someone be able to get those case numbers from somewhere? Is there a place they can get that information?
So yeah, they're on the Department of Public Health website. So you can click on your county on the map and that will give you sort of like a cumulative snapshot of where you are. But also on the right-hand side where the graphs are, there's a drop-down menu. So you can select by county instead of at the state level. So you can see how disease has tracked over time, deaths, if you're unfortunate enough to have them in your county, you can see how those have tracked over time. And so that can be a great place to start in terms of how your area is doing. The other thing I would recommend that everybody do is find out what your public health district is and follow them on social media, follow them through their website, because at least mine, I live in the North Central Health District, so that covers Bibb County, Houston, and others. And they produce a situation report every week or every 2 weeks, I can't recall right now. And it's fantastic. I mean, it covers everything from, how long a person had to wait to get their test collected to what is going on at each county and whether they consider it an area of concern or not. And so if you're not already following your health district, I think that's a great idea to do that. You can Google that information and get it.
Kathy, you got any questions?
I just want to go back a little bit about the data the state is collecting. You mentioned in your newsletter that you served on the state COVID data task force, but that it's been stood down. Do you know, because of lack of funding, what kind of impact do you expect that to have on the state's ability to respond?
So I think what has been really great about this task force is, so I was invited to join that by the Department of Public Health. It also features other state agencies like GEMA, the Georgia Geospatial Information Office. They create all the maps, for example, and some others. Oh, so like Georgia Tech had an involvement. MIT was part of it. We had a lot of really smart people all kind of coming together, and there was this great sort of integration of information and how can we package and visualize the data to make it meaningful for the public. And I think I don't know exactly what is happening in the future with us, because like I said, we're out of funds. And the last I heard was that we were kind of waiting on Congress to decide on an aid package to determine our next steps. And since that has stalled, I don't really know what that means for us. But what I have noticed is that ever since we stood down, GEMA has gotten later and later in their reporting of the daily report. And in fact, on Saturday, they didn't report at all. So and since we count on that information for hospitalization data and bed capacity, that's pretty important. And I don't know if that has anything to do with what we were doing, but that was an interesting sort of temporal association that I could see.
Okay. But the information that they were having you guys help with was for the public, really? It wasn't really to guide policy decisions or the response at all?
So it's a little bit of both. A lot of it was for public use. Some of it was for internal stuff, so that, like, say, GEMA could prepare for where hospital equipment would need to be deployed to best serve the needs of the people of Georgia. There was the reason why some of those university partners were involved was because they were modelers. So they were sort of trying to predict when is the surge going to happen, so that the state could build capacity to prepare for those sorts of things. And, we worked together on quite a few things. One of the things that I was most proud of was we built this kind of one-stop shop for the Department of Education to kind of gauge what the relative risk was of reopening schools, considering everything having to do with COVID to things like how many kids live in a multi-generation home, knowing that, if there's a grandparent at home and we know that they're among the vulnerable, what is the relative risk of doing that? So it didn't end up becoming widely available, but it was probably one of the things I was most proud of us working on.
So let's talk about contact tracing, because I've actually started to do a little digging on it myself. We had a couple of COVID cases within our local school district, and I contacted them, and I said, if the contact tracers actually talked to you, and they said they hadn't heard from anybody. And then I talked to the Cobb County schools, and they kind of danced around it a little bit, and they didn't say yes, they didn't say no, but from the way they acted, I got the impression that maybe they hadn't. Hans had recently recovered from a COVID diagnosis, and he, of course, was contacted. But when this happened to him, I think it was when we had sort of passed that first peak around May when we started opening up everything again. But I also know from another friend that they were not contacted by the contact tracers. So what exactly is going on? Because isn't the contact tracing kind of important for this whole thing?
It's super important.
Yeah.
Sorry, I don't mean to laugh because it is critically important. But so I can't speak to what's going on in terms of on the ground stuff because I'm not involved in that process. But theoretically, the way that contact tracing is supposed to work is that, yes, when a test result comes back positive, the WHO guidance is that they are supposed to contact the positive case within, I think it's 24 hours, and have a list of all of their known contacts within 48 to 72 hours. But I think what we've got going on here in Georgia is that they've always been understaffed and overwhelmed. And that's been true since the beginning. Even when they started to hire more people, then our transmission went up. So it's kind of this weird catch up. I think I mentioned that that NPR and Johns Hopkins study where they tried to assess how many contact tracers we had. And I said that we have just under 12% of the estimated need. It averages out to 13 investigators for every 100,000 residents in Georgia. So, I mean, that we need a bigger boat. I mean, like that's just nowhere even close to being enough. And so what I think may have happened in some cases is they sort of abandoned some of the contact tracing, especially if the case was identified based on a sample that was collected 3 weeks ago. Well, whatever happened with them is the horse is out of the barn. Like we can't do anything about that right now. So let's work on the most recent stuff. This is my estimation. This is what I'm guessing they're doing, is they are prioritizing the more recent finds and investigating those.
I suspect that it's also the case that the test reporting and when you're contacted by or you get your results back, it's also prioritized around the positives as opposed to the negatives, right? So I know when I tested positive, I received that information like the next business day. Literally, it was over the weekend, but so Friday I tested and Monday I got my results, and I was contacted by an individual for contact tracing within probably 48 hours, but it was quite quick. My family went and got tested after I tested positive, obviously, because we'd been in contact. And it was 7 or 8 days before they got their test results back, which were all negative. But that obviously there was a different, or it's hard to say because you don't see what the machinations are behind the scenes. But I mean, it certainly seemed like there was some priority placed. I would suspect appropriate priority placed on getting back to the individuals that were positive.
Absolutely. I mean, I don't want anybody to feel left out, but there's not quite as much value in following up with people who were negative. But I mean, we absolutely, if anybody's positive, the goal should be for those people to be traced and contacted and tested that are around them. I also want to say, a lot of schools, because of HIPAA and other things, they may be reluctant to do their own contact tracing. And so there's a sort of a deference to the Department of Health and expectation that they would do that. And I just don't know that there's enough workforce there to make that happen. So what I have been encouraging people to do is to keep a journal of, if you run into people, write down who they are so that you can contact them. If heaven forbid you ever do turn up positive, you can sort of initiate your own contact tracing just so that they are aware. Because I don't think any of us would ever want somebody that we know and care about to get sick with this, but we definitely don't want them to be caught off guard either. So I think that while these delays are happening and it's really frustrating that they exist in the first place, there might be things that you can do to look out for the people around you.
So we have a question from a reader. Crystal Blue asks, in your August 10th newsletter in reference to the IHMF model, you said if even the rosiest COVID-19 projection models is saying that Georgia needs to consider a statewide stay-at-home order, then that's saying something. What are the less optimistic models showing, the ones that don't assume we will have a mask mandate or stay-at-home order anytime soon?
So let's see, I don't spend as much time in models as I do in hard data. I mean, I have a lot of respect for models, but it's just not where I place my emphasis. The ones that I have seen, a lot of them did predict our July surge. And I have seen some data to suggest that we might expect another intensification in mid-September. And I think that IHME is also showing that. And so they are concerned about a surge in mid-September that might warrant us having to do something like another shutdown. And I talked about it in part because, you know, sort of like if this is the model that even the White House is using to, you know, say that we're doing a great job or whatever, and even they're saying that maybe Georgia needs to consider closing, that's, like I said, that's saying something. But also because if you're a local business owner, I want you to know that that's a real possibility. And if I can give you as much heads up as I possibly can so that you can prepare to survive whatever shelter in place might be necessary, then that's what I want to do. I mean, just like I'm sure many of you, during the shelter in place, I was ordering as much as I possibly could from my local restaurants because I wanted them to survive this thing. And just, you know, anyway, I just have a heart for those people and I want them to survive, I guess is what I should say.
Yeah. Why aren't we seriously talking about this? I'm really surprised. Frankly, I feel like we're all the state leadership in any way is in sort of denial about what's going on because we're having these what I think are insane discussions about, well, why can't we have football? Well, I mean, why can't my kid go into kindergarten? You know, I mean, well, why I don't understand why we're moving ahead as if we've got this thing under control when we don't. Who needs to be the one to speak up and say, is it the governor? Is it state legislators? Who needs to get us on the right track here?
Your guess is as good as mine.
Now, look, it's the governor. It's the governor. It's the governor. Like, let's just, I'm not, like, I'm happy to take the bullet on this one and state it out clear. This governor in this state made a set of decisions that has put us in the position that we are in. It is a wholly foreseeable and an eminently predictable position that we are in over and over again. What is happening has been predicted, and what is going to happen is being currently predicted. And it absolutely requires the governor, you know, Brian Kemp has to step up to the plate on this. And so far, he has not. And this is the reason why Georgia is in the position that Georgia is in. That's it. That's it. Full stop. That's the ball game. The governor has to step up. And until he does, we're not going to see a recovery. I mean, we don't have to talk about the economics of this. It's awful where we are right now. A shutdown would also be awful. But it's a choice literally of 6 to 8 weeks of short-term pain or this that we're experiencing now for another 8 months to 12 months before we have some sort of broad-based vaccine that we can depend on.
George, do you want to weigh in on that?
So, yeah, I think the governor's a doofus, but he is what we've got. The hard part for me is having to work around all of these people. I mean, you know what I mean? Like the idea that I'm fighting over whether or not the stats are real and whether or not there's been political manipulation on the data, instead of fighting about whether or not we should be wearing, the idea that I have to argue about whether or not people should be wearing masks is absurd. The idea that I'm viewing the governor as an adversary to public health right now is insane. And the idea that we have to deal with all of this on a local level is nuts. And I am beside myself. The thing I am keying on is the degree to which, like, none of this is a scientific problem. It's all a communications problem. Like the ability to convince people in an era of disinformation and propaganda and social media noise to do things that should be completely obvious. So here's the thing I want to know. Amber, what have you learned about how to communicate with the public through all of this? Like, what are the lessons that public health communicators can take from your personal experiences right now so that as we go forward, people stop doing stupid shit?
Okay, so this is actually something I've been invited to speak about at a couple different venues. So I was ready for this one. So one thing that I think that scientists especially tends to happen to us is that One thing I have to remind everybody is just because somebody's asking you a question, try to take that as a genuine interest in learning at first. If they're a troll, that's a totally different thing. But I think sometimes scientists have this perception that, I've got such and such degree, so obviously I'm right. And I think that we need to recognize that the public really doesn't get it sometimes. And so if we can walk people through data, and if we can help them to better understand how graphs and charts and maps work, we build better data savvy consumers of data or information. And so that sets us up not just to better combat this pandemic, but other issues of science and medicine that are important for things like climate change or conservation efforts or planning for the next pandemic, heaven forbid. So that's one thing that I say to public health people is just remember who your audience is. Understand that they don't know what the scientific method is. And so we have to, and for a lot of people, they haven't had to think about these things since high school. We have a society that is built on instant gratification, where they, like you guys in Decatur, can order your groceries and have it delivered within an hour. And that's not the case in rural Georgia, for example. I know, it's awesome, right? And I think that when you're built for instant gratification, you expect fast answers to all of life's problems. And the pandemic is, in many ways, we're stuck with the same solutions that we had 100 years ago for the 1918 pandemic, social distancing, bans on large gatherings, et cetera, because it takes a long time to build a vaccine. And so people don't like slow answers. They can get whatever they want really quickly. The other thing is we don't necessarily have the best community orientation in our society right now. We just, because of social media and other things that have isolated us, we don't tend to have that community before self sort of mindset. And so I think that has harmed us in some ways too, and really didn't set us up well for this pandemic. But when you have that situation going on, you can see why shelter in place wasn't successful or wasn't going to be successful in terms of getting people to stay home or limit their interactions. So
we have a question from Alex Brown. She asks, I was wondering if Dr. Schmidtke has any concerns about the accuracy of certain types of tests.
I do. So we have several different kinds of tests that are available. They can be what's called PCR or molecular tests, and that's looking for the presence of the virus's genome. So we have a DNA genome, the virus has an RNA genome, but we're looking for the presence of that. And that's like a fingerprint. It's unique to the virus. So that is like, if that's there, that's what it is, that kind of thing. We also have antibody tests. And for this, they would probably need your blood sample to do that. And what that's looking for is when you are infected with something, over time, your immune system responds. And the sort of the finish line piece of the immune response is the production of these antibodies. And they start as early as 7 days after exposure and infection, but they peak around 21 days after an exposure. And so, what this shows us is recent infection. It could be recent, or they could also be looking for more long-term exposure to it happened more distantly in the past. And so the problem with that is that COVID is a coronavirus, one of hundreds of coronaviruses that circulate in the human population. And antibodies, they can sometimes be close enough and react to things. This is why we still recommend that you get the flu shot, even if we don't predict with 100% accuracy what next year's flu strains will be, is because there will be some cross protection from the antibodies that you generate. And so when we test for COVID antibodies, there may be cross reaction between, say, your antibodies to other circulating coronaviruses. And so that's why the antibody tests aren't used to confirm a case of COVID-19 really anywhere in the country, and definitely not here in the state of Georgia.
Another question.
So what was interesting, if I could expand on that a little bit, what you were describing on the RNA test, if it finds it, if you get a positive result, you have it, really. I mean, it's hard to fake RNA. The challenge is if you get the negative results, there are 1,000, that's an exaggeration, but there are a number of ways where you could have it and it just didn't get picked up in that sample. And particularly with like the self-administered tests and where, people are legitimately reluctant to push that thing all the way into the back of their sinuses because it's really uncomfortable. A negative test does not mean you don't have it. It just means you weren't detected. Whereas a positive test more or less definitively means that you do have it.
So absolutely. So one problem that comes up is when they collect your specimen and it turns out negative, that just means you were negative on that day. So you could get your specimen collected, go to the beach, go to the bar, go do whatever, and you come up positive sometime between when your specimen was collected and when your test result comes in. And then you get this negative result and think that you're in the clear. And that's not quite correct. The other thing is, when we have people after the protests in Atlanta, after the death of George Floyd, I had a lot of people asking, when do I need to go get a test? Because I was around a lot of people. And because of the way viruses work, when the virus comes into your body, it goes into what's called an eclipse period. And that lasts about 3 days anyway, it happens initially. And what happens there is that the virus goes into your cells, hijacks them, starts making copies of themselves, and then they break out and go infect neighboring cells. And so while they're inside those cells, they're effectively hidden. We can't detect them. And so what we were recommending and what the CDC director ended up directing people to do also was to wait 3 to 7 days after a risky exposure and then go seek a test. So that's something to keep in mind if you know that you're going to a family barbecue, which I don't recommend. But if you do and you're worried, then go get your test 3 to 7 days afterwards. But you're absolutely right. I mean, all sorts of things could cause that to be negative. Like maybe the lab technician didn't grab enough of the right volume of the sample. A lot of this process is automated, so that shouldn't be a problem necessarily. But we can see false negatives as well.
So we have another question from a reader who asks, how much consensus is there in the medical public health community about the scope and scale of this? Is it like global warming where it is clear, or is it like a room full of people actuallying each other into the wall?
So I don't know if I totally understand what this means in terms of, is there consensus in the public health community that this is a real issue?
I think that's what you're asking.
Okay, or is this a hoax? Got it. All right, so I guess what I would say is within the public health community, I think this is like global warming. Like you probably have 99% of the people in it saying, absolutely, this is a big deal. And most of us will not be getting on an airplane anytime soon. Most of us are not sending our kids to school. And so I think if you need a barometer of where we are, ask your nearest epidemiologist how we're reacting to this, and would we risk our family to do it, to eat a hamburger inside of a restaurant, for example. So I absolutely think that this is real, and I think that is the consensus among our community. So I guess that's how I'd answer that.
So go ahead.
I was going to ask, given that you specialize in communicating some of this stuff, I mean, two primary issues with communication at the very beginning of this was, masks aren't particularly helpful. And I understand that was done to protect a limited supply, but I think we're dealing with the consequences of that particular communication now. And then the second one was, it doesn't really hurt the youth. It doesn't hurt kids, right? This isn't really something to take serious with kids. And even though in terms of the severity of the disease, that's potentially correct, in terms of transmission, that has turned out to be completely false. Can you speak a little bit to those communication breakdowns and what other things would you potentially change in terms of the way that this has broadly been communicated from the beginning and that we've learned probably put us on the back burner in terms of our effective response?
Sure. So like you said, I think early on, the thing with masks was we knew that there was a limited supply of PPE, and we wanted to make sure that our healthcare workers had first crack at that. I think it is unfortunate because it gave people the impression that they didn't need one, when I think we can all agree that some protection is better than no protection. And I do wish that had been better communicated from the beginning. I will say that science, one of the things I love most about it is its ability to self-correct in terms of, as we learn more things, then we adjust our thinking. And that includes the issue of masks. Another thing you mentioned, I think, was, about transmission in kids. So I think that there was a lot of, So one of the things that's really interesting is right when we knew that this pandemic was going on, virtually all the schools in the world shut down, right? And so we had limited evidence for what it was going on in terms of transmission to and within kids. And a lot of it was coming out of China, where they have a one-child policy, or did for a long time. So there weren't siblings at home for this disease to go from one kid to another, and we weren't having mass gatherings of children in a school. And so the hole in this argument that you could drive a truck through was that we didn't have the opportunity for the disease to go to kids. And so we just didn't have enough data. I think that we've seen both in some of the more recent studies, but then also in our experience here in Georgia, is that it transmits among kids just fine. And so I think it's unfortunate that, and what I would say is the thing that's most frustrating as somebody who works in public health is that, you know, we kind of make these predictions and we don't actually want to be right, but we often are. And we're not really here to ruin people's barbecue or to ruin homecoming or football or anything like that. But the goal here is prevent suffering and death. And so what's frustrating in it is when you do say, you know, I don't know that opening schools is the best idea, guys. And they're like, no, it doesn't transmit among kids. And then they open the schools anyway. And then we have kids get sick. I mean, I don't enjoy being right about this stuff. So
how do you though, because you're describing two different forms of communication. One is we have the data and we know this is the case. One is we have the data and we know that it isn't the case. And then you've got the scenarios that you're describing where we don't have the data, but everything that we understand would lead us to believe that this is what the data will show when we have the data. Like that last pit also has to be able to guide public policy, right? Like, yes, we didn't know whether kids could transmit this virus, but I don't think there was anyone in the public health sector serious that looked at that and said, well, then it probably isn't going to happen. Right? You know what I mean? Like there's literally no other virus that follows that. Right. Like, and so, you know, we have a ton of models that look like COVID that all transmit within kids, you know? And so there is no, you're absolutely correct. We didn't have that data, but that didn't mean we didn't know. And that I think is the part that is missed in that communication.
Yeah, I mean, absolutely. It's a hard place to be in, right? So because, you know, we have imperfect data. The pandemic is relatively new. I mean, believe it or not, like our first cases here in Georgia were in February. And that feels like forever ago because Tiger King was what we were all watching. And I know I feel 10 years older already by now, but it really wasn't that long ago. And the other thing I should mention is that science is really slow. For us to know whether like hydroxychloroquine or another therapeutic is working takes controlled studies and lots of repetition before we can publish that information and get it out there. And so the pandemic is evolving fast, but we are sometimes slow to get the information out the way that we need to in science. And for good reason. We want to make sure that we're doing it right. And so the peer review process in science is critically important for that. We've seen certain reports get fast tracked so that the information can be out in the public because of the benefit to humanity to have that information. But there's always going to be sort of a self-correcting aspect of this, right? We gather more information, somebody else tries to replicate that person's findings and they can't. Well, then we get a self-correction that guides future experiments, policy, that kind of stuff.
So we're coming up on the hour. I wanted to end with this final question. What do we have to get to in order for children to safely return to school? What has to happen? What are the conditions that we need to meet before we can safely do that, do you think?
So I think that I keep harking back to this because at one point I had young kids, but this reminds me a lot of the story of the little red hen, that you have to do the work in order to get the rewards. And when you don't do the work, you aren't entitled to the rewards. So when we saw places like New Zealand and parts of Europe and other countries lock down to reduce their transmission rates, they've been able to reopen, and they have the same economic problems that we do. Everybody in the world is being affected by this at the same time. And they took the approach of, we're going to close down and try to knock down transmission so that we can properly track and monitor and keep an eye on this. And because of that, they have their transmission relatively under control, and they can reopen. They can go back to potentially normal life a lot sooner than we can. And I think what we probably need to be able to do, like some of you have suggested, is something like another shutdown. And it doesn't have to be forever, but it needs to be enough to bring our transmission to within limits that our testing, our contact tracing, and our hospitals can cope. I mean, right now, it just feels like we're adding more gasoline to the fire every day. And so, until we get disease transmission under control, I don't think we can see normal life until that happens.
Well, Amber, you're doing great work, and we put a link to your newsletter and your Patreon in the comments. I hope you will join us again. Everybody, this is Amber Schmidtke. She is a COVID analyst, and her newsletter is required reading if you want to understand anything about COVID-19 in Georgia. I just want to remind everyone that we will be back on Friday at 6 o'clock. We broadcast every Wednesday and Friday at 6. Our guest this Friday is going to be Marlon Walker, who is a reporter at the AJC. He covers DeKalb County schools. Probably one of the best reporters around, so I'm really looking forward to talking to him. I just want to close on a personal note. I lost a very dear friend of mine within the last week. Mr. William Moses, and if you enjoy Decaturish and enjoy what we do, you owe a certain debt to him because he was a big influence on me growing up. And I just want to let everyone know that if you have somebody in your life that you haven't talked to in a while and haven't heard from in a while, reach out to them and see how they're doing, because a lot of people are struggling right now, and not everybody is on Facebook or Twitter broadcasting that. So just wanted to leave you all with that note, and I will hopefully see everyone again, all of our viewers, this Friday when we talk to Marlon Walker. Have a good evening, everyone.